A very good morning to respected dignitaries on dais and my co-participants. I am Dr. Krupavaram from School of Pharmacy, KPJ Healthcare University College. And today I am going to present on the research title Evaluation of Anti-Stress Activity of Orthosiphon stamineus Benth Ethanolic Leaves Extract on Wistar albino rats. A brief introduction on the stress. Stress is nothing but a simple reaction on the stimulus that will disturb our either mental or physical equilibrium. It may have a major role play on our neurons also. It may lead to neurodegenerative disorders. And not only that, stress will make our daily functioning also get disturbed. And the stress is coming from different areas nowadays, from social, occupational, academic, and emotional as well. And due to this stress, there are so many organs which are affecting in our body, like the heart, immune system, and digestive system. These are the major areas. Coming to the symptoms of the stress, there are so many symptoms showing physically due to physical stress or due to psychological symptoms. Varies for psychological stress and emotional stress. Maybe patient will show in the form of depression or behavior stress. That particular person may end up with sometimes with smoking or any drinking addiction habits. Coming to the literature review, there are so many drugs available so far to control or to suppress the stress, but they are not actually helping to subside the fully the stress. It is only helping to subside the symptoms of the stress. Example, anti-anxiety drugs, antidepressant drugs, beta blockers so far available in the market. But unfortunately, we have a lot of side effects for these drugs on long-term usage. That limits the usage of this particular drugs. And not only that, stress will make the whole reaction of our body, which will disturb physiologically, and it will cause damage to our organs if it is at a chronic stage. And one of the internationally recognized phenomenon, what they said is that mainly nowadays the stress is due to advancement of industrialization. And also therefore only nowadays every individual is facing stress by day-to-day life, which is disturbing their physiologically. Coming to the pathophysiology, if you look into closely, actually our system internally get disturbed to start from the brain. That means it is affecting at the hypothalamus area, where it is releasing cortisol releasing hormone, and that is activating our anterior pituitary gland, and that in turn releases ACTH, which will act on adrenal cortex, and that releases glucocorticoid. In another side, sympathetic nervous system also get affected, but SNS will affect only for short-term stress, and HPA axis will affect only for the long-term stress. SNS will help for to combat the stress for on acting on the adrenal medulla, particularly the epinephrine and norepinephrine. These are the hormones what I just now mentioned during the stress condition. And this is a picture what I was telling you the sharing about the in my previous slide about the long term response via bloodstream, and this is about the short term response. The norepinephrine is the one which is releasing. And stress is not at the worst scenario every time. We cannot think like that. So it is varies, depends on what type of stress. That means it can be mild, moderate, or severe. Only at the severe stage or chronic stage only that particular person may problem with the damage of vital organs. And nowadays we have, as I already told previously, so many drugs, even though available in the market for the anti-stress activity. These drugs have got a limitation because of the two main things. One is toxicity, another one is dependency. So because keeping in this mind, unable to proceed further. Therefore, only they are in turn of searching for the better drug, which is a preferably herbal drug that can help to reduce. So therefore, only we are in search of screening of anti-stress agents by using some of the animal models. So these are the models available in for currently physical and psychological stress models. We selected two models from each of them. Adaptogens. What is meaning of adaptogen? Meaning we are adapting ourselves to the stress. That means that to combat that particular stress, our body we are preparing. That's what our herbs all we are talking about. It is not that it will not allow stress to come inside, but it will help to withstand the stress without affecting our major organs. And the best adaptogens already available in the market, the Withania somnifera, Panax ginseng, all these drugs are already well established adaptogens which can increase our immunity. In that scenario only, we have looked into closely one of the important medicinal herb that is called Orthosiphon stamineus Benth. And this is the taxonomical classification and vernacular names. The famous name for the Misai Kuching is in the local Malaysian name for this plant. And botanical description, here is a botanical description. It belongs to the Lamiaceae family. It is also famous by the name called Java tea. And here are our aim and objectives. And our main aim is to determine the in vivo studies on anti-stress activity of this orthosiphon plant by using Wistar albino rats. And that is our primary objective as well. Secondary objective is to find out to prepare the extract and to find out the preliminary phytochemical methods, phytoconstituents, and also to evaluate the hematological parameters and biochemical parameters. And this was our hypothesis, which successfully we could able to achieve this hypothesis. And coming to the materials and methodology, our plant has been identified and authenticated and kept in our university college as a specimen. These all are the findings we are under the second objective, that is preliminary phytochemical screening by using various standard methods. And the rats what we selected, as I've already mentioned, Wistar albino rats. And this is the first test, that is called forced swimming endurance test, where we are allowing the rat to swim for 7 days by giving extracts for before giving swimming. And the cutoff time for this is the rat allowed the minute rat drowning, we will take that as a cutoff period, and we will take out on the 8th day of this test. We will collect the blood by using mild anesthesia by collecting from the retroorbital method, and we test for various biochemical parameters. Same goes to noise induced stress. What we will do, our cages, we will above the cage we arrange the speakers of 30 centimeters above. Make sure of 100 decimal. More than that we should not keep. And 4 hours we have to expose every day for 15 days. And on 16th day we collected blood and analyzed on all the parameters. This is our grouping, group 1 until group 5. All the groupings you can see here: the normal control, negative control, positive control, low dose and high dose of our extracts. So after a mild anesthesia, we collect the blood and analyze it for all the biochemical and hematological parameters and tested. After the results have been analyzed by using student t-test. Here are our results, and the results are very promising, and we got almost all positive except steroids, fixed oils, tannins, and gums and mucilage. And coming to the results part, results, if you notice closely, forced swimming stress, all the parameters have been increased during stress time. We can see here all the parameters, this line has been increased. This is a normal control. And if you see, this is our low dose and high dose. All the parameters, suppose example of this one, WBC is normal is 9,000, but stress time it is increased to 12,000. But our extracts could able to reduce to 10,000, which was almost equivalent to standard drug, that is ashwagandha, 10,000. So that means all the parameters, if you notice, all are highly significant and some are significant like that. So that means all our biochemical parameters and hematological parameters have been reduced due to by treating our drugs. Another important thing I want to tell here is the high dose has got better response when compared to low dose, which is almost comparable to the local ashwagandha, that is already available marketed product. This is the swimming time. You can see here also clearly the rat can swim until 132 minutes when compared to the normal rat 98 minutes only. And ashwagandha, which is 134, almost comparable our rats. This is means showing that this drug is highly significant and the response was very wonderful. And whatever the explanation, whatever I showed in the results, the same thing, the tabulated one I converted in the word form. All these things. And coming to the noise induced stress, same thing happened. All the stress during stress time, all the parameters has been increased very high. And at the same time, by using our drug, it reduced all the parameters, including BUN, ACTH, all the parameters. And here is the explanation. Coming to the discussion part, what could be the reason for these results? And hyperglycemic response generally we will see during stress time, maybe due to effect on the pancreas, and also cholesterol is rising very high because the catecholamines are indirectly helping to mobilize the lipids from adipose tissue. Even triglycerides are high, maybe because of the mediated via urinary medullary axis. That could be the mechanism why it is increasing. One level why it is increasing blood urea nitrogen, because of mobilization of the protein metabolism is higher. That indirectly will help to increase the urea secretion into the blood. Also we can see very high, and also we can see this effect on the adrenal cortex major, right? So therefore even in the blood cell count also, when cortisol hormone releases, automatically WBC level will be very high. Particularly neutrophils are very high. And also the another important thing here, both the forced and noise swimming stress also show very good action, and compared to both, forced swimming stress has got better action compared to better response, I mean compared to noise induced stress. And here is another important point is RBC. Could be why the RBC would have been increased, because usually during stress time spleen will contract and release more amount of blood. That's maybe the reason, one of the reason for spleen, for the RBC to increase. And almost all the parameters are significantly reduced. The increased level of parameters, whatever increased parameters during stress time has been reduced effectively in our by treating extracts like high dose and low dose. But at our surprise, high dose has shown almost same levels of reduction like our Withania somnifera. What could be the reason? The main, closely if we look the phytochemical profile, all these phytoconstants are available. And another thing, Withania somnifera also we already closely look into the phytoconstants. All these phytoconstants, glycosides, flavonoids, terpenoids, saponin, all these are available even in our plant. That could be the reason why it is showing a very good action. But at the higher dose, it is having a higher significant value compared to the lower dose. In conclusion, we could say that Orthosiphon stamineus is a very good anti-adaptogenic activity it is showing, but the results are almost benchmark, are comparable with the Withania, only the high dose, due to the existence of maybe glycosides, flavonoids, terpenoids, triterpenoids, saponin, and all these things. But one thing is here, further studies are really needed for isolation and characterization of phytoconstituents of Orthosiphon that may help us to lead into a development of proper adaptogenic activity that can be used in controlling the different varieties of stresses. And here are my references. And thank you. And thank you for the opportunity given and to share my research findings.